Let's talk about restriction now. I always, I'm sure of it, I always explain this in the consult, but I'm gonna tell you again. The sleeve gastrectomy is not a restrictive procedure. It's a metabolic surgery. We're going to change a lot of your hormones. We're going to improve your metabolism and your physiology. The stomach is made by 3 layers of muscle. Muscle is elastic. The body is going to adapt to the change because that's what the body does. The body is an amazing machine. It's going to adapt to all changes. This time the change is in the volume you're eating. After surgery, it's going to be 1, 2, 3, 4 ounces of capacity. It's different for everybody. Please understand that the caliber of the sleeve is going to be the same for you all because I'm using the same bougie and I'm using that's the calibration device. Let's say this is your stomach, okay? Well, now I'm going to calibrate it so the caliber is going to be the smallest size possible, but that is still capable of letting you drink and eat. And then I cut it. I do the stapling, and now you have your sleeve gastrectomy. We cut out the stomach, and your caliber is this. Okay, I always mobilize the bougie to be sure we have the caliber necessary. So all of you have the same caliber in your sleeve, but not all stomachs are the same. This stomach is 4 fingers in length, but another stomach will be 6 fingers, 7 fingers, 2 fingers. Some stomachs are really short, some stomachs are really large. So that is what makes the difference in the post-op, in the immediate post-op capacity. That's why some people can drink 2 ounces and some people can drink 3 ounces because the stomach was larger or smaller or shorter. So again, that's the smallest caliber possible. The stomach is made by 3 layers of muscle. Muscle is elastic. The body adapts because that's what the body does. So with time and the gastric motility, because the stomach contracts for gastric emptying, with time, the body is going to adapt. And your sleeve, it's going to stretch. Yeah, I know, it sounds like a horror movie, but your sleeve is going to stretch. That is a fact. And there is nothing you can do. Okay? I need you to understand that. Your stretch is going... Your sleeve is going to stretch and there is nothing you can do about it. Okay? Nothing you can do. That's just an adaptation. That may happen in 1 year, 2 years, 3 years post-op. I've done some sleeve to bypass revision surgeries. All of them looks really wide. That's because the stomach is stretched. It's not related to the amount of food or the kind of food you're eating. It doesn't matter. You're not gonna stretch it with mechanical methods. You're not gonna stretch it with mechanical methods. It's just an adaptation that is going to happen. But let me tell you something, this is the good part. This is the good part. And this, well, I have a great example. Dr. Seeley in the States proved he did sleeve gastrectomy on rats. He proved that restriction doesn't last like a lot. Basically, it was a couple of days on these rats, and then they were eating as much as the rats without the sleeve gastrectomy. So restriction is going to happen for a while, and then you're not going to have restriction at all. But you're going to keep losing weight. That's what we call the honeymoon period. You're doing whatever you want to do, but you're still losing weight. You're cheating. You're getting ice cream or something, and you're still losing weight. That's the honeymoon period, because your hormonal, your set point is being reprogrammed. Your body's detecting the excess of energy and it's burning it. So it's a metabolic surgery. It's not your restriction. Okay, again, your sleeve is gonna stretch. Your restriction is gonna disappear. The bad restriction, the severe restriction is gonna disappear. It's gonna take some time. It could be 6 months. It could be a year. So what's gonna happen to you? Well, this is what's gonna happen. You're gonna use the initial restriction. You're gonna use your amazing weight loss and your nice looks after you shrink and you are nailing these really sexy new dresses and stuff. All this momentum, this motivation, you're gonna use it to keep going and keep having a healthy lifestyle. You're gonna keep using it to eat healthy, to get better choices of food. You're gonna use it to exercise because you don't want to get back to square one. You're gonna do it because you're motivated. You're gonna do it because you're committed. You're gonna do it because you're in this group. And remember that only nice looking people is in this group. So you have to do it if you want to be part of the group. Okay? So that's why I do the support. That's why this group exists. That's why I do these videos every week. Because you need support. You need guidance. You need to learn how to eat and exercise properly. If you don't change your lifestyle, you're not going to be successful on the long term. Restriction is not the culprit here. Don't blame it on the sleeve. Don't blame it on the surgeon. Don't blame it on the restriction. Okay? You have to do your part. If you're disciplined, you're going to be successful the rest of your life. You're going to lose your weight. You're not going to get it back. So please, 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 just do your part. Exercise. I get this a lot. Like, oh, doctor, after a year, I just lost 70 pounds. I have 40 more pounds to lose, 30 more pounds to lose. Oh, doctor, I'm not stalled. I'm not losing weight. Okay, my answer is the same all the time. Describe your diet. Describe your exercise. And they are like, well, I'm eating pretty normal, 3 times a day. I'm eating, sometimes eggs and tortillas, and sometimes a sandwich, and whatever. That's not a healthy diet, and you know it. You are not exercising at all. You're like, well, I'm not really exercising. I mean, sometimes I go walking and stuff, and no. You need to exercise as you mean it. You need to walk as you mean it. You need to sweat. You need to increase your heart rate. You need to do some weightlifting or something that makes you build up some muscle. Okay? So, remember, you have to just change your cassette or your DVD or your USB, whatever you're using nowadays. Change your mindset. Reboot your system. Upgrade to a new operating system, whatever you want to call it. Because you need to change inside. Okay, it's not just the surgery. Don't blame it on the surgery. And the same is going to happen with the bypass. So don't let me start with that. Okay, that don't even mention it because it's the same exactly. The pouch is going to stretch. The intestinal villosities are going to grow. Again, the body is going to adapt. The body is going to adapt. So even your malabsorption is going to decrease a lot because your intestinal villosities are going to grow. So the surface of absorption is going to increase again, and the pouch is going to stretch. Again, the body is going to adapt. It's always going to find a way. And now I hope this is. This breaks the myth. There are lots. You know what? It's been years. I've been fighting this theory for years and years and years. I'm glad Dr. Seeley proved the restriction doesn't last a lot and it's not really important in this surgery. So, okay, now I'm gonna choose some questions. Okay, I'm not gonna answer them all. And they have to be related to the topics. Dry skin. Revision surgery, cysts, no, okay. Ablations, multivitamins. Okay, don't get me started with that. Okay, the patches. I don't know. I never use them. I'm not sure if they work. I will definitely read all of your comments later. You have to go. Okay. There's. Oh, I don't get this question. Women with PCOS have a much higher risk of blood clots, and I have that into consideration. Well, the blood thinners have a prophylactic dose. We are not using high doses, or like we are treating a clot already, so it's not a high dose, and we use enoxaparin, so it's prophylactic, so just it's for preventing the clots, but no. Okay, the stretching. If you don't follow the 30-minute rule for waiting and drinking. Okay, again, the stretching of the sleeve is not a mechanical thing. It's not like you're gonna eat a big, like you do a big bite of beef and you swallow it and now your sleeve is bigger than it was before. It's not like that. But just please try to chew a lot and take some time, because that's gonna help you to learn how to eat properly. And Jennifer, you're 100 fingers in line. Okay. Well, I think I'm really, I can tell there are lots of questions. I think these topics were really interesting. I can tell there are some interests here. And you're all really funny. I love my family. Okay, that's a good question. No true demand. I'm definitely not saying it's better to have the bypass. Definitely not. That's not what I'm saying. Remember, I believe the sleeve is good enough. The bypass, there is no question that it's better for diabetic patients on the long term and for people with severe reflux, because I cannot promise you to fix your reflux once I'm there, because if you don't have a hiatal hernia or anything like that, I cannot control your reflux or improve it a lot. Most of the times people with, some reflux are gonna be cured because of the weight loss and because I dissect the esophagus, I fix the anatomy, and because of the technique I use. So most of them are gonna be cured from reflux. But if your reflux is severe and daily, I won't take any chances. I mean, if it were in your place, I will choose the bypass because my reflux is daily. It's severe. It's affecting my lifestyle. So I don't want to get any chances, so I go for a bypass. But I don't really think it's better than the sleeve. I think the sleeve is great for weight loss. It's as good. It's not that I believe it. There are lots of studies that prove that the weight loss is basically the same, and actually the sleeve is going to make you lose weight faster. And on the long term, it's going to be pretty similar. So I don't think it's really better at all. And okay, I think this is going to be the last comment I do because it's really late. Lakeisha, you're telling me that restriction is what truly helps you early on. I think that's questionable. Let's ask Jeannie. Jeannie is in the hospital right now. Well, she had a bypass, but it's the same for the sleeve. It's exactly the same. And the ladies here are not, or the guys here are not gonna let me lie. Just ask the people that already had the surgery how hungry they feel after surgery. How much hunger they're feeling. Like, are you starving? Because you have been on the pre-op diet for a couple of days and now you're just getting liquids for 2 days. You're about to go to the hotel and yes, you want to have some chicken broth or beef broth, but how much hunger are you really feeling? And 90 9 point something% of the time, they will tell you they are not hungry at all. And that's not due to restriction. It's because your hunger hormones are decreasing. It's because your metabolism is changing. So restriction, for me, is more like an excuse. You want to think it's a restriction. You want to think that there is a physical barrier restricting your caloric intake. So you're afraid to lose that barrier. But that's not the case. You just need to change your mindset. You need to follow a diet. Following a diet is super difficult because you're craving all the time. You're starving. I understand that part. But after surgery, there are going to be no cravings. You're not going to be this severe anxiety. So you're going to be super capable of following the diet, as a soldier. You're going to be disciplined. You can do it because you have the tool to do it. So I believe this is a myth we need to debunk today. Don't think about restriction a lot, and don't get me wrong. I'm not saying you're not going to have restriction, because you will. You will have restriction, a physical barrier, physical restriction. But that's not the point. That's not even important. That's not necessary. Some of you are going to experience a hunger-like feeling, and that's the acid. Some of you are going to feel this void. That's the acid, Some of you are going to have real hunger. Who cares? You're hungry, you eat. You're not hungry, don't eat. That's simple, okay? Don't get afraid. Don't be worried about feeling hungry, because that's just natural. It's normal. So don't be afraid. Just eat every 3 hours. Healthy food, healthy snacks, and that's it, okay? So, and this question is, what do you do if you think your sleep is stretching? Well, you definitely don't do the reset your pouch diet or all that kind of groovy stuff. Like, let's reboot the system with clear liquids, and now your sleep is gonna be super slim and tiny. No, it doesn't work like that. How much can it stretch? I will say, by experience, I'm not measuring it, I don't have the exact number, but I've seen it several times, and I will say that probably 15%. It's never gonna be like it was before surgery. Okay? Never ever. And one last comment, because it's too much. I need to go. I have some consultations and stuff. This is my last statement of the day. The stretching of the sleeve means you can eat more. The stretching of the sleeve means your gastric capacity is increasing. But the stretching of the sleeve doesn't mean you have to. You don't have to. You can eat more, but you don't have to do it. You know what I mean? Yes, you can, but you don't have to. I mean, you can, I can stab my hand with this fork right now, but I don't have to, right? It's the same. You can eat more, but you don't have to do it. So there are lots of things you can do right now, but you don't have to do it. So please don't, okay? And, okay, that's gonna be it. So, I will read all of your questions, I promise. And, well, that was a great reaction. And yes, I say it like it is, so. Well, I think Jeannie and I have a really, like our sense of humor, it's pretty much alike. So, well, family, it was my pleasure having you here. I think this was one of the most successful videos. It's that's right, Jenny. Okay, Jenny and Jeannie. Okay, have a great Sunday, you all.